going to talk about Dabigatran versus Warfarin in patients with mechanical heart valves. So let's start with the definition of a heart valve surgery. A heart valve surgery is used to repair or replace diseased heart valves. And there are several types of heart valve prostheses. For example, mechanical valves made of metal, stainless steel, or titanium last the longest. The disadvantage is that you will need to take blood-thinning medicines such as Warfarin for the rest of your life. Now let's watch a video about a heart valve surgery. Mechanical heart valves require anticoagulation in order to prevent valve-associated thrombosis and thromboembolic stroke. So oral vitamin K antagonists such as Warfarin are prescribed universally. Oral agents do not act immediately and usually require at least 5 days to achieve a therapeutic effect. In this case, we use oral vitamin K antagonists. Now let's read about the non-vitamin K antagonists as oral antibiotics.
Number 4. Non-vitamin K antagonists as oral anticoagulants.
Blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Deep vein thrombosis, or DVT, is an example of an abnormal blood clot that forms in a major vein of the leg. When these clots break off from the vein, they can travel to the lung, causing pulmonary embolism. Collectively known as VTE, venous thromboembolism, this serious and life-threatening condition affects more than 1 million Americans each year. Oral anticoagulant therapies have been used as a preventive measure against the formation of these dangerous blood clots. Problems with unpredictable effects, the need for close monitoring, as well as food and drug interactions, have made these current methods of therapy difficult to manage, prompting researchers to look for alternatives. Promising results in the development and testing of 2 new non-vitamin K antagonists as oral anticoagulants present more convenient treatments for patients.
As a matter of fact, anticoagulants are a class of drugs that work to prevent the coagulation or, in other words, the clotting of blood. So Dabigatran and Warfarin are important medications used to reduce the risk of the stroke and blood clots. Let's watch a video about the difference between Dabigatran and Warfarin.
Coumadin or Warfarin and Pradaxa or Dabigatran both are used to thin the blood so that you can prevent strokes from occurring in atrial fibrillation. The advantage of Coumadin is that it certainly thins the blood, but it does require consistent checks at a doctor's office or an institution. The Pradaxa is a new medication that was just released in the November-December timeframe in 2010, and the highlights of this drug are that it can thin the blood just like Coumadin and be as protective as Coumadin, but it doesn't require any checks at all, blood checks, and you are not limited in your type of food that you take.
Let's talk about the pros and cons of Dabigatran and Warfarin medication. First, Warfarin. Warfarin is an inhibitor of blood clots, and it can be reversed by the use of intravenous vitamin K. I think that it is the most important of the benefits that has Warfarin. And also, Warfarin has been proved for use in people with atrial fibrillations, with clots, and like veins and lungs after a heart attack. The disadvantage of Warfarin is that there is a great difficulty in maintaining a stable effect in the body. And we have to make some changes in diet. For example, we have to increase or decrease the intake of certain foods containing vitamin K. Another disadvantage is that it requires regular blood tests. Dabigatran is an oral direct thrombin inhibitor, and it is an alternative to Warfarin. We can use Dabigatran in order to prevent strokes and systemic embolism. The disadvantage of Dabigatran is that it can cause indigestion, upset stomach, and stomach pain. The most important is that there is no available medication to reverse the blood clot effect in case of intoxication. Another disadvantage is that it can cost a lot more than Warfarin. It's like this drug has a very short life in the body. So, conclusion, which is better, Dabigatran or Warfarin? Well, the use of Dabigatran in patients with mechanical heart valves was associated with the increased rates of thromboembolic embedded complications. This was because Dabigatran has relative inability to suppress the activation of coagulation that occurs when blood is exposed to artificial surface of blood prostheses. So the best is Warfarin. So how is Pradaxa when you Pradaxa or Dabigatran?
Accident because once you go on it, it will thin your blood, but you can't stop that effect. And so if somebody has a situation where they start bleeding, it's irreversible. So people are needlessly bleeding to death as a result of being on Pradaxa.
Unfortunately, what we found out after months of the drug being on the market is that if you have a bleed while you are on Pradaxa, there's no way for your doctor to stop it. And so while with a drug like Coumadin, or Warfarin as it's generically known, you're able to provide drugs, that is vitamin K, or you can give things like fresh frozen plasma that can stop the bleeding if you were to have a bleed. Unfortunately with Pradaxa that's not possible. And as a result, we've seen it rise in the first year and a half that it's been up on the market to the deadliest drug that is on the market today.
Now, the diseases related with this topic is that are infective endocarditis, paravalvular regurgitation, and hemolytic anemia.
This is Dr. Cal Shipley with a review of endocarditis, cardiac valve vegetations, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia or sepsis. As the organisms travel through the heart, they attach themselves to the valve leaflets between the heart chambers. The oxygen and nutrient-rich environment found on the left side of the heart results in rapid growth of organisms, which form clumps known as vegetations. Unpredictably, the vegetations may detach from the valve leaflets. The vegetations are then ejected into the aorta, where they may travel up into the arteries of the brain, causing obstruction to blood flow and subsequent stroke.
Thank you for watching.